Good morning, everyone. My name is William Adams. I am a member of the Medical and Science Advisory Board at the Corias String Institute, and I'm also currently an assistant professor within the Department of Kinesiology at the University of North Carolina at Greensboro. My goal this morning is to provide you an overview of the purpose and methodology regarding the recently accepted paper, State-Level Implementation of Health and Safety Policies Pertaining to Preventing Sudden Death and Catastrophic Injury in Secondary School Athletics. This paper will be published in print in the September issue of the Orthopedic Journal of Sport Medicine. As the number of student athletes participating in high school sports continues to rise, with over 7.8 million athletes currently participating, also comes the increasing number of injuries sustained during and surrounding participation in sport. This, unfortunately, also includes the increasing number of both fatal and catastrophic injuries as well. Death or catastrophic injury during sport participation can either be classified as direct or indirect in cause. Direct deaths are those resulting from a traumatic incident, such as a traumatic head injury, cervical spine injury, or a traumatic injury to one's internal organs. Indirect deaths are those resulting from exertion-based causes, such as sudden cardiac death, exertional heat stroke, and exertional sickling. Within high school sport from 1982 to 2015, there were 735 fatalities and 626 catastrophic injuries, with 75% and 98% of these being attributed to indirect and direct causes, respectively. Furthermore, evidence shows that 90 to 93% of all causes of death during sport are attributed to four specific causes: sudden cardiac death, traumatic head injuries, exertional heat stroke, and exertional sickling. With these causes accounting for nearly all death during sport and physical activity, identifying strategies to both prevent and manage these appropriately is paramount for optimizing the outcomes of our student athletes. Evidence from both the NCAA as well as high school athletics has shown that implementation of best practice policies surrounding the prevention and management of these leading causes of death has been successful in reducing the risk of such injuries. Unlike the NCAA, which can implement policies for its member schools across the United States, implementation of policies at the high school level is on an individual state-by-state basis. The National Federation of State High School Associations oversees and governs 16 sports at the high school level and annually produces rules handbooks for each sport that outlines rules related to fair play, sportsmanship, even play between both offensive and defensive sides of the game, as well as minimizing risk during participation. However, these rules only apply to competition, leaving rules related to training and preparation for competition up to each state. At the state level, each state's high school athletics association is tasked with developing policies and procedures for its member schools. 50 of the 51 state high school athletics associations have sports medicine advisory committees, which are made up of sports medicine professionals that are available to provide recommendations and guidance for policies related to health and safety. Unfortunately, most sports medicine advisory committees have no voting power on proposed policies specific to health and safety, leaving the final vote and decision up to the High School Athletics Association's executive committee, which may not have any medical expertise. Furthermore, developing and implementing best practice health and safety policies at the state level allows for the appropriate policies to be in place for all the state association's member schools. This is important as only 70% of high schools across the United States currently have access to an athletic trainer who is a healthcare professional with specific training on preventing and managing the leading causes of death and catastrophic injury in sport. Without an athletic trainer being employed at the high school, it is up to the local school administrators to ensure that the appropriate policies are in place to protect the health and well-being of their student athletes. And when the state does not have appropriate policies in place, the risk of catastrophic outcomes or injury remains. Therefore, the purpose of this study was to examine the implementation of health and safety policies specific to sudden death and catastrophic injury at the state level for high school athletics. An inter-association task force for preventing sudden death in secondary school athletics, best practice recommendations, was published in the Journal of Athletic Training in 2013 and was endorsed by some of the leading medical and sport organizations in the country, such as the American College of Sports Medicine, the American Medical Society for Sports Medicine, the American Orthopedic Society for Sports Medicine, the American Osteopathic Academy for Sports Medicine, the National Athletic Trainers Association, the National Federation of State High School Associations, and the National Interscholastic Athletic Administrators Association. This document provides the current best practices for appropriately managing potential causes of sudden deaths specific to high school athletics and was the primary source utilized for this study. Other current best practice positions and consensus statements were also utilized for this study to ensure that all current best practices on the topic of sudden death and catastrophic injury were included. A rubric was created to assess each state's implementation of best practices related to the leading causes of death and catastrophic injury in sport. The rubric was divided into 5 subsections that focused on sudden cardiac arrest, traumatic head injuries, exertional heat stroke, appropriate healthcare coverage, and emergency preparedness to allow for a comprehensive analysis of each state's policies. Following the development of the rubric, the content of the rubric was validated independently by 5 researchers who were experts in the area of preventing sudden death in sport. These individuals were all athletic trainers with a collective 38 years of clinical experience and over 78 peer-reviewed publications on this topic. The rubric was adjusted appropriately based on their feedback. The next steps included an in-depth analysis of each state's health and safety policies surrounding the leading causes of sudden death and catastrophic injury. Only policies that were mandated or required to be in place for all state association member schools were included for review. States that had policies that were recommended or encouraged did not receive credit, as this allowed for individual schools to decide which policies they wanted to implement. 2 researchers with over 8 years of experience working specifically on this topic within high school athletics, along with 14 additional years of clinical experience as athletic trainers, extensively reviewed all pertinent and publicly accessible documentation from each state for the 2016 and 2017 academic year. This included each state's high school athletics association handbook, their website, any enacted legislation signed by the governor on the relevant topics in question, and any policies that were in place to the state's Department of Education. Both researchers independently reviewed and graded each state's policies. Following the independent review, both researchers met to compare their findings. If a discrepancy arose, a discussion occurred between the researchers to arrive at a consensus, and a third person was brought in as the final decision maker if a consensus was not made at that time. Following the completion of the review and grading of each state's policies, the researchers sent each state their own respective state's rubric to review. This was done to provide an additional layer of scrutiny to ensure that all policies were properly identified through and during the review process. The rubric was sent to all 51 state association executive directors, as well as the attendees of the 2017 Collaborative Solutions for Safety in Sport meeting, in which the attendees were initially informed of the project. The state representatives were given 30 days to review the rubric and provide any feedback if discrepancies existed. With any discrepancies, the state representatives sent along the appropriate documentation for review, and changes were made to their grade if the documentation provided appropriately addressed the specific recommendations within the rubric. Following the 30-day review, all data was compiled and each state was ranked from 1 to 51 to allow for a comparison between states who have implemented best practices for the leading causes of death and catastrophic injury in sport. And with that, I'm going to turn this over to Dr. Douglas Casa to present the findings from this study.